Hi friends, welcome you all back to the Nurse channel. So as you all aware that the next very important nursing officer recruitment exam is going to happen is the JIPMER examination, which is scheduled on December 18th. So whoever written the old JIPMER exams knows that the question pattern of the JIPMER is cannot be predicted because it may be sometimes very tough and there are less chances to get direct questions. So keeping all these points in mind, we are in the track to prepare you well for the upcoming JIPMER examination and other competitive nursing examinations. So in this video, I have included nearly 20 very important questions which are taken from different aspects of the nursing subjects and some GK questions also, which are also very important. So I request everyone who are watching this video to watch the video till the end because I have given such a good explanation for each questions, and I request everyone to share about this platform to your nursing friends and kindly subscribe our channel. So straight away, without losing time, we will move on to the series. This is a JIPMER series with 20 important questions including GK. So straight away moving on to the questions. Moving on to the very first question in this series. So the first question for you is in the screen right now, and the question is, tuberculosis can be separated into how many categories of progression? So tuberculosis can be separated into how many categories of progression? And the options for you are option number A 1, option number B 2, option number C 3, and option number D 4. So how many categories of progression for tuberculosis? So what is the answer? It's a direct question, and the answer for this question is option number 3. So as we all know that the tuberculosis, it is separated into 3 categories of progression, which means the first one is the exposure, the second one is the latent infection, and the final one is the active phase of disease. Okay, so we will see what is an exposure. Exposure means this happens when a person has been in contact with or exposed to another person who has TB diagnosed. Okay, so the exposed person will have a negative skin test, a normal chest x-ray, and there will not be any signs and symptoms of the disease. Okay, so this should be you should understand very well, because questions can be asked like in which phase of progression there will be a positive skin test, there will be a positive x-ray finding. Those things also can be asked. So in the exposure phase, the all tests will be negative. There will be negative skin test and a normal chest x-ray, and there will not be any signs and symptoms of the disease. So the second stage is the latent TB infection. So this happens when a person has TB bacteria in his body, but he does not have any symptoms of the disease. Okay, so the TB remains inactive throughout his life, and this person would have a positive skin test but a normal chest x-ray. So that is the difference between exposure and latent infection. Here the skin test will be positive, but the chest x-ray will be normal, and there will be the TB bacterium will be inactive throughout his lifespan. Okay, so that is the latent TB infection, and the next progression is the active TB disease. So this describes the person has the signs and symptoms of the active TB, and the person would have a positive skin test and a positive chest x-ray. Okay, so I think you understand the difference between the exposure, the latent infection, and the active TB disease. So there are 3 stages of progression for TB. Okay, so that's all regarding the first question. So we will move on to the second question in our series, and the question is, study of anterior chamber angle is called as. So this is from the ophthalmology. The study of anterior chamber angle of the eye is called as dash. That's a question for you, and the options are option number A pachymetry, option number B gonioscopy, option number C tonometry, and option number D perimetry. So what is the study called? Study for the anterior chamber angle. So what is the answer? So all the options what I have given here are diagnostic investigations for certain diseases in the eye. So what is the answer? So the answer for this question is option number B, that is gonioscopy. So we will see what is gonioscopy and the other investigations. So gonioscopy, it is an eye test that checks for the signs of glaucoma, okay, and it uses a special lens and a slit lamp to evaluate the eye's drainage angle, that is the anterior chamber angle, okay. So gonioscopy for the evaluating the eye's drainage angle, that is anterior chamber angle, okay. So that is the first option. Then the next options we will see what is a tonometry. So tonometry, it is a test which is used to measure the pressure inside the eyes, okay, and we know that the normal eye pressure, which ranges from 10 to 21 millimeter of mercury. So that is tonometry. And another option was perimetry. So what is perimetry? Perimetry is a systematic measurement of the visual field functions, okay. So this is a systematic measurement of the visual field function. And final option was regarding pachymetry. So what is pachymetry? Pachymetry is a simple, quick and painless examination which is used to measure the thickness of the cornea, okay. So from this question you are getting information regarding the 4 diagnostic tests in the ophthalmology. So I think that also is clear for you. Now we will move on to the third question in our series, and the question is in the screen right now. So the question is, what is the most rare type of thyroid carcinoma? So which type of carcinoma, thyroid carcinoma, is very rare? That is a question, direct question. And the options for your option number A, follicular carcinoma, option number B, papillary carcinoma, option number C, medullary carcinoma, and option number D, anaplastic carcinoma. So which is the most rare type of thyroid cancer? That is a question for you. So what is the answer? So whenever any types of any forms of carcinomas are concerned, so we should learn which is the most common type and which is the rare type, okay. So we can expect questions like this. So what is the answer for this question? So the answer is option number D, that is anaplastic carcinoma, okay. So you should understand which is the most rare and which is the most common type of carcinomas in the thyroid gland. So the papillary carcinoma is the most common type of thyroid carcinoma, and it accounts for approximately 80% of thyroid carcinomas, okay. So papillary is the most common. Then next comes the follicular carcinoma, which is accounts for approximately 10%. Then comes the medullary carcinoma, which accounts for approximately 5%, and the most very rare form of thyroid carcinoma is the anaplastic carcinoma. So that is the answer for the question I have asked, okay. So moving on to the next question in our series. So the next question is it is a GK, and the question is, in which year the name Pondicherry was changed to Puducherry officially, okay. So this is regarding Pondicherry. So in which year the name of Pondicherry was changed to Puducherry? So the options for you are option number A, 2000, option number B, 2004, option number C, 2006, and option number D, 2008. Direct simple question. So the answer for the question is obviously option number C, 2006. In 2006 the Pondicherry name was changed to Puducherry, okay. So moving on to the next question, that is the 5th question, and this is a very important question, and the question is, the esophageal opening in the diaphragm transmits all except. So you know that there is an opening in the diaphragm, so through which the esophagus is passing, that is hiatal opening. So through that opening, which all structures are passing, that you should understand. The question is, the esophageal opening in the diaphragm transmits all except, and the options for you are, first one is the vagal nerve trunk, option number B, esophageal branches of gastric artery, then option number C, right phrenic nerve, and option number D, esophageal branches of gastric veins. So which is the right answer? So among this, which was not passing through the esophageal opening in the diaphragm? So what is the answer? So the answer for this question is option number C, that is the right phrenic nerve. So right phrenic nerve is not passing through that opening. So the esophageal hiatus, it is an opening in the diaphragm through which the esophagus and the vagus nerve trunk passes, and it is placed superior, anterior, and slightly left of the aortic hiatus, okay. And through this opening it transmits the esophagus, the vagus nerve, the left inferior phrenic vessels, okay. So the left inferior phrenic vessel, not the right phrenic vessel, and some small esophageal arteries and veins, okay. So So these are the structures which are passing through the diaphragmatic hiatus. Okay, so next, I think that also is clear for you. Now we will move on to the next question in our series. That is a question number 6. The question is regarding the joint. Manubriosternal joint is an example of which type of joint? Okay, so the question is manubriosternal joint is an example of which type of joint? So the options for you are, the first one is the synovial joint. Option number B is the primary cartilaginous joint. Then second one is the secondary cartilaginous joint, and the final option is the syndesmosis. Okay, so the question may looks very easy, but the options are slightly confusing. So what is the answer? Manubriosternal joint. So the answer for this question is option number C, that is secondary cartilaginous joint. So you should understand what is the difference between primary cartilaginous and the secondary cartilaginous joint, and regarding the synovial joint. So I'll give you a brief explanation regarding these joints. So first of all, we will discuss about the synovial joint. So we know that synovial joints are the most common type of joint. So this is the answer for another question. So it is the most common type of joint in the body, and these joints are otherwise known as the diarthroses, which means they are freely mobile. Okay, they are freely mobile, and we know that there are 6 classifications. So the first one is the hinge joint, and the example is the elbow. The next one is a saddle joint, that is a carpometacarpal joint. Then next comes the planar joint, that is the acromioclavicular joint. Next comes the pivot joint, that is the atlantoaxial joint is an example. And then comes the condyloid, that is a joint which is the metacarpophalangeal joint is an example. And the final is the ball and socket joint, and the hip joint is the example. Okay, so this is a 6 classification for the synovial joint. You can refer it later, because all the questions can be asked from any of these areas. That's why I am explaining this. So next type of joint is the cartilaginous joint. So cartilaginous joint, already we have explained that we have 2 types, that is a primary cartilaginous joint and the secondary cartilaginous joint. So cartilaginous joints are connected entirely by the cartilage, that may be fibrocartilage or with the hyaline. So primary cartilaginous joint means otherwise known as the synchondrosis, and these bones are connected by the hyaline cartilage. Okay, not the fibrocartilage. It is connected by the hyaline cartilage and sometimes occur between the ossification centers. Okay, so the example you should understand: the first sternocostal joint, then the neurocentral joints of the vertebrae. All these are the examples for primary cartilaginous joint. Okay, so these bones are connected by the hyaline cartilage. Then what is the secondary cartilaginous joint? Secondary cartilaginous joints, otherwise known as the symphysis, and these include fibrocartilaginous and hyaline joints. Okay, so here we will have fibrocartilaginous and hyaline joints, which usually occur at Manubriosternal joint, then intervertebral disc, and the pubic symphysis. Okay, so these are the examples: Manubriosternal joint, intervertebral disc, and the pubic symphysis. And this is the picture for just for your understanding. So this is a manubrium, and this is the body of the sternum, and here comes a Manubriosternal joint, which is a secondary cartilaginous joint having both hyaline and the fibrous cartilages. Okay, and the final option was regarding the syndesmosis. So what is a syndesmosis? Syndesmosis is a, as the name indicates, it is a complex fibrous joint. Okay, it is a complex fibrous joint between 2 bones and connected by ligaments and a strong membrane. So this is a complex which contains the fibrous joints between the 2 bones and connected by the ligaments, then strong membrane with slight movement allowed. So only slight movement will be allowed. And the example, one of the examples is near the ankle joint between the tibia and the distal fibula. Okay, so there will be a minimal, a slight movement will be there, and it is a complex. Okay, so that is known as a syndesmosis. Okay, so with this question we are getting a bunch of information, like which are the types of joints, types of synovial joints, then primary cartilaginous, secondary cartilaginous, and syndesmosis. Okay, so I think this question was really helpful for you. Moving to the next question in our series, the 7th question, and the question is: which of the following is a measurement test that is important for the prognosis of multiple myeloma? Okay, so the question is: which test will be useful in identifying the prognosis of multiple myeloma? And the options for you are: the first option is MRI, the second option is minimal residual disease or MRD, then third option is CT scan, and the final option is angiogram. So which among this is important for identifying the prognosis of multiple myeloma? So that's a question for you. So what is the answer? So the answer for this question is option number B, that is minimal residual disease, otherwise known as the MRD, which refers to the small number of cancer cells that remain in the body after the treatment. Okay, so as the name indicates, it is a residue. Okay, that means a small number of cancer cells that remain in the body after the treatment. So what is the significance? Its clinical significance is this measurement test will indicate whether the current treatment is working or not. That means the prognosis of the disease can be identified, and if the MRD test is positive, means that a residual disease was detected, and a negative result means that the residual disease was not detected. Okay, so that is minimal residual disease. Okay, I think that is clear for you. Now we'll move on to another GK question, that is the 8th question. So now this is a football season, and the question is regarding a football player. So who becomes the first male football player to score in the 5 World Cups? Okay, so the question is who becomes the first male football player to score in the 5 World Cups? So the options for you are option number A, Lionel Messi, option number B, Cristiano Ronaldo, option number C, Neymar, and the final option is Robert Lewandowski. So who score in 5 World Cups? So the answer for this question is obviously option number B, that is Cristiano Ronaldo. Okay, so we will move on to the 9th question in our series, and the question is here in the screen right now. Which type of isolation category is indicated for a burn patient? Okay, so which type of isolation category is indicated for a burn patient? And the options for you are option number A, airborne isolation, option number B, strict isolation, option number C, reverse isolation, and the final option, no isolation required. So what is the answer for the question? So the answer for this question is option number C, that is a reverse isolation. So why reverse isolation? That we will explain now. So the objectives of reverse isolation therapy in the treatment of burns are: the first one is to eliminate the exogenous sources of infection and prevent the emergence of resistant endogenous bacteria. So that is the primary objective, and the other objectives include to assure an optimal influence of the patient's immune response to the infection, and the third objective is to deliver optimal patient care in a pleasant treatment atmosphere. This is very, very important. And the final objective is to reduce the mortality secondary to the infections. Okay, so for meeting these objectives, we should keep the patient in the reverse isolation while treating patients with burns. Okay, so I think that also is clear for you. Now we'll move on to the next question in our series, that is the 10th question. So the question is regarding the enema administration. Question is, while undergoing a soap solution enema, the client complains of abdominal cramping. So as a nurse, what you should do? So that is a question. It's an application level question. So while undergoing a soap solution enema, patient was complaining of abdominal cramping. So as a nurse, what you will do at that time? And the options for you are option number A, immediately stop the infusion. Option number B, you should lower the height of the enema container. Then option number C, you should advance the enema tubings 2 to 3 inches further. And the final option is you should clamp the tubings. So as a nurse, what you will do if the patient was complaining of abdominal cramping while administering soap solution enema? So what is the answer? I think it's a basic simple question, and the answer for this question is obviously we should lower the height of the enema container. So what will happen if we lower the height of the enema container? The drainage will be the infusion will come down, the speed of infusion, the rate of infusion will come down, and thus it will reduce the cramping. Okay, so the nurse should lower the container if the client complains of the abdominal cramping, and the installation should be slowed in the instance of abdominal cramping. Okay, so the other options are wrong, because we should not do clamping, because it may prevent the client from retaining all the solutions what we have infused, and which would alter the effectiveness of the enema. And if the nurse stops the infusion, if we are stopping the infusion, the client will not receive all of the fluid, and the purpose of the enema will not be met. and the enema tubing should not be advanced further because it can increase further. The rectal damage can happen, as well as there will be chances for increasing the abdominal cramping. Okay, so the other options won't met the purpose of the enema. So the best option is to lower the height of the enema, so that the infusion rate will be reduced. Okay, so whenever patient pain gets resolved, then we can keep it back in the old position. Okay, so that is the answer for that question. So we will move on to the next question, that is the 11th question in the series, and the question is, which is the best position to place a patient in the first post-operative day for a total hip replacement? So the question is very simple. In which position you will keep a patient after total hip replacement surgery? Okay, so the options for you are, the first option is side lying on the operative side. The second option is on the non-operative side with the legs abducted. Then the third option is side lying with the affected leg internally rotated, and the final option is side lying with the affected leg externally rotated. So this is a very important question, and it is slightly confusing also. So in which position you will keep the patient after the total hip replacement surgery? So what is the answer? So the answer for the question is option number B. You should keep the patient on the non-operative side with the legs abducted. That is very important, because the patient's leg should be positioned in abduction. This is to prevent the dislocation of the prosthesis. The purpose is to prevent the dislocation of the prosthesis, and it is very crucial that the normal the femoral head component of the acetabular cap is maintained in the correct position. Okay, so if you are keeping in the another positions, like in the affected side, or if the leg is rotated internally or externally, whatever it is, there are chances like that processes can get dislocated, and the purpose of the hip replacement won't get. Okay, so that's why we have to keep the patient always abducted in the non-affected side. Okay, so that is the answer for that question. Now we will move on to the next question, that is a 12th question in the series. So the question is, which of the following laboratory parameter is used to classify anemia into microcytic, normocytic or macrocytic? So which is the criteria for classifying anemia into three types? Okay, so on what basis we are classifying anemia? So that is a question, and the options for you are option number A, mean corpuscular volume; option number B, mean corpuscular hemoglobin; option number D, mean corpuscular hemoglobin concentration; and the final option is red cell distribution width. So slightly confusing. So you should understand what is mean corpuscular volume, mean corpuscular hemoglobin concentration, and red cell distribution width. Then only you can answer this question. So the answer for this question is obviously option number A, that is the mean corpuscular volume. So this is the laboratory factor or the parameter that classify the anemia into microcytic, normocytic or macrocytic. So we will see in brief regarding these terms. So what do you mean by the mean corpuscular volume? So this is otherwise known as the mean cell volume, and it is a measure of the average volume of a red blood corpuscle. Okay, so it is a measure of the average volume of the red blood corpuscle, and the measurement is obtained by multiplying a volume of the blood. Okay, so there will be a volume of the blood will be there, so we have to multiply that by the proportion of the blood, that is cellular. So the cellular proportion of the blood into the volume of the blood, and it has to be divided by the number of erythrocytes in that volume. Okay, so this is a laboratory parameter. So this measurement can be obtained by multiplying the volume of the blood by the cellular proportion and then dividing it by the number of erythrocytes in that volume. Okay, so that is the mean corpuscular volume, average volume of red blood corpuscles. So the normal MCV or the mean corpuscular volume is 80 to 100 femtoliter. Okay, 80 to 100 femtoliter. So this is also important. So we will see the other one, that is the mean corpuscular hemoglobin. What do you mean by mean corpuscular hemoglobin? or the mean cell hemoglobin. So this is the average mass of hemoglobin per red blood cell in a sample of blood, in a given sample of blood. So the average mass of hemoglobin per RBC in a given sample of blood. And the normal mean corpuscular hemoglobin is 27 to 31 picogram per cell. Okay, 27 to 31 picograms per cell. And we will see next the mean corpuscular hemoglobin concentration, otherwise known as the MCHC. So it is a measure of the concentration of hemoglobin in a given volume of packed red blood cells. Okay, measure of the concentration of hemoglobin in a given volume of packed red blood cells, and the normal MCHC is 32 to 36 grams per deciliter, or otherwise 320 to 360 grams per liter. Okay, so this is a mean corpuscular hemoglobin concentration. So the concentration of hemoglobin in a given volume of packed red blood cell. Okay, so that is the mean corpuscular hemoglobin concentration. And the final option was the red blood cell distribution width, otherwise known as the RDW. So this is a measure of the range of variation of red blood cells that is reported as a part of standard CBC. Okay, so in a standard CBC, how much variation in the range of variation of the RBCs will be calculated, and that is termed as the red blood cell distribution width. Okay, so I think that also is slightly confusing, but it is very, very important. Okay, so I think that is clear for you now. So we'll move on to the next question in our series, and the question for you is in the screen right now. The 13th question: a child with asthma has an order for salbutamol. So before administration of the medication, the nurse must. So the question is, so what is the pre-care for a patient receiving salbutamol? Okay, so the options for you are: option number A, pre-oxygenate the patient; option number B, assess the patient's heart rate; option number C, obtain venous access; and option number D, feed the patient a snack. So what you will do for a client, for a child with asthma receiving salbutamol, before giving salbutamol? So what is the answer? So if you know the side effects and other problems of the salbutamol, you can answer this question very easily. So the answer for this question is obviously option number B, that is assess the patient's heart rate. Why? So that we will see in the explanation for this question. So the most common side effect of the salbutamol are fine tremor, anxiety, headache, muscle cramps, dry mouth, and palpitation. Okay, so palpitation is very, very important, and the other symptoms may include tachycardia, arrhythmias, flushing of the skin, myocardial ischemia, which is very, very rare, and disturbances of the sleep and behavior. So among these, the priority we have to be given for the palpitation, tachycardia, and arrhythmia, because it is life threatening. So before that, we should check for the pulse rate of the patient, and if it is very high, it has to be notified to the physician and necessary changes have to be made. Okay, so I think that also is clear for you. Now we will move on to the next question in the series, that is the 14th question, and the question is: an adaptive state associated with a withdrawal syndrome upon cessation of a repeated exposure to a drug is termed as. So this is a definition regarding a term, so you should identify that term. So an adaptive state which is associated with a withdrawal syndrome upon cessation of a repeated exposure to a drug is termed as dash, and the options for you are: the first one is tolerance, the second one is addiction, the third option is dependence, and the final option is reverse tolerance. So what is the answer for this question? So all these terms are really, it is confusing, but it's very, very important. Tolerance, addiction, dependence, reverse tolerance. So the answer for the question what we have asked now is option number C, that is dependence. So we will see what all are the definitions for the terms. So first of all, addiction. So what is an addiction? So as the name indicates, it is a disorder. It is a biopsychosocial disorder which is characterized by persistent use of drugs, which is including alcohol, despite substantial harm and adverse consequences. Okay, so this is a disorder. Addiction means that is a disorder. Okay, so the next option was Dependence. So what is dependence? Dependence means it is an adaptive state. Okay, this is not a disorder, it is an adaptive state which is associated with withdrawal syndrome upon the cessation of the repeated exposure to a stimulus. So if you are stopping or if you are stopping a repeated exposure, like a repeated use of a drug, then the patient will be developing some withdrawal syndrome, and that state is known as the dependence. Okay, then you should understand what is tolerance. So what is tolerance? Tolerance is the diminishing effect of the drug resulting from a repeated administration at a given dose. Okay, so for example, if the patient is taking 1/4 of alcohol daily, so when time passes, the patient won't get the desired effect with 1/4 of alcohol. Okay, so the patient may force to increase the dosage, like 2/4, 3/4, etc., to get a desired effect what the patient was getting before with 1/4. So that is known as a tolerance. I think that is clear for you. Now the final option is the reverse tolerance, otherwise known as the drug sensitization. So this is the escalating effects of a drug resulting from a repeated administration at a given dose. Okay, so this is a reverse of the tolerance. That means the effect of the drug will be increasing from a repeated administration at a given dose. The dose will be same, but the effect of the body will be increasing. Okay, so that is known as a drug sensitization or reverse tolerance. Okay, so I think you are getting information. Your confusion is clear, I believe. So then we will move on to the next question in our series, that is question number 15. So another important confusing GK. So Constitution Day is celebrated on which date in India? So Indian Constitution Day is celebrated on which day? That is the question. And the options are: option number A, 26th January, option number B, 15th August, option number C, 26th November, and option number D, 1st May. So which day is celebrated as Constitution Day in India? So will be there are chances that you can make this answer wrong, because the answer for this question is 26th November. So we will have a small explanation regarding this question. Constitution Day is celebrated on 26th November every year in India to commemorate the adoption of the Constitution of India. So the Constitution of India was adopted by the Constituent Assembly on 26th November 1949, and it came into effect on 26th January 1950. Okay, so this was adopted on 26th November 1949, which is considered as the Constitution Day, and it came into effect on 26th January 1950. So 26th January we are celebrating as the Republic Day. Okay, so don't be confused between the Republic Day and the Constitution Day. Okay, so that's all regarding that question. So next we will move on to the 16th question, and this is another very important confusing question. And the question is: the stage of dying as identified by Dr. Elizabeth Kubler-Ross occurs in what order? So I am asking you regarding the order of stage of dying as identified by Dr. Elizabeth Kubler-Ross. So the options for you are: option number A, anger, depression, bargaining, denial, acceptance; option number B, bargaining, denial, anger, acceptance, depression; option number C, denial, anger, bargaining, depression, acceptance; and the final option is depression, denial, anger, bargaining, acceptance. Okay, so in which order is the stage of dying is happening? So that's a question for you. So this is also a very important question from the psychology, and the option number C is the answer for the question. So DABDA, that is denial, anger, bargaining, depression, and acceptance. This is the stage of dying which is identified by the Dr. Elizabeth Kubler-Ross. So what is a denial? Denial begins with the initial shock of the diagnosis. Okay, so the patient will be in a shock that this disease has occurred for me, and they will think like, okay, no, there is no disease for me, like that. There will be some defense mechanism will be there during this period, and when the denial phase, the patient move on to the next phase, that is the anger phase, and it will often follow the denial, and the patient begins to realize that the diagnosis is real and they can no longer deny the prognosis. And this realization may be met with anger or even rage, and they will think like, why it has happened to me, like that questions patients may raise. That is the second stage, denial, anger. Then the patient will move on to the bargaining stage in which is manifested as the patient accepts the terminal diagnosis even more and but strives to postpone the death, and this stage is characterized by the patient making negotiations. Okay, so this is the stage of negotiations. So this is the answer for another question. In the stage of dying, the negotiations happen during which stage? That like that questions also you can expect. So then after bargaining it will comes the depression stage. That means when the bargaining attempts fails, the patient moves into another phase known as the depression stage, and this stage is characterized by mourning. Okay, so this is the depressive phase, and finally patient will move on to the acceptance. That means that it will describe recognizing the reality of a difficult diagnosis while no longer protesting or struggling against it. Okay, so finally the patient will accept that this has happened to me and that I am going to die. Okay, so there is an abbreviation to remember this, that is a DABDA. Okay, denial, anger, bargaining, then depression, and finally acceptance. Okay, so this is the stage, these are the stages of dying. Okay, now we will move on to the next question, that is the 17th question, which is a application level question. Question is, a patient is transferred to intensive care following a craniotomy. So the first sentence itself is very important. The patient was transferred to the intensive care following craniotomy, and the patient is difficult to arouse, and the pupils are pinpoint and non-reactive. So the pupil here is pinpoint, non-reactive, and the sensorium of the patient is it is very difficult to arouse the patient. So which medication should the nurse prepare to administer in such a situation? So you should be ready for administering which medicine. So that's a question for you. It's a simple question, and the options for you are option number A, adrenaline, option number B, thiamine, option number C, naloxone, and option number C, dextrose 50%. So what is the answer for this question? So pinpoint pupil, non-reactive pupil, difficulty to arouse, these are the key points, and it was patient is coming after craniotomy. So these are the clues, and the answer for the question is obviously option number C, that is naloxone. So you know that during the craniotomy procedure in the OT, patient might have received opioids. So opioid overdose or opioid use can result in the reduced pupils will be pinpoint, there will be non-reactive, and the patient will be difficult to arouse. So to reverse that, we have to administer which medicine? That is naloxone, that is a opioid antagonist. Okay, so naloxone, it is a medicine that rapidly reverses an opioid overdose, and it is an opioid antagonist. This means that it attaches to the opioid receptors and it reverses and blocks the effects of other opioids. Okay, so naloxone is the drug of choice for the opioid. It's an opioid antagonist. Okay, so I think that also clear for you. Now we'll move on to the 18th question in our series, and the question is, in order to minimize the muscle strength loss while in the lower body cast, the nurse will instruct the patient in the performance of which type of exercises? So here the patient is with the lower body cast. So the question is, which exercises you will be performing on the patient? Okay, we will be instructed to perform which type of exercises. That's a question for you, and the options are option number A, isometric exercises, option number B, isotonic exercises, option number C, passive range of motion exercises, and option number D, isokinetic exercises. So you should understand the terms isometric, isotonic, isokinetic, then passive range of motion exercises, then only you can answer this question. And the key point in this question is the lower body cast. Cast means the patient should be immobile. So these are the clues for finding the answer for this question. So what is the answer for the question? So the answer for this question is obviously option number A, that is isometric exercises. So isometric, what does it mean? So isometric means isometric exercise is one that involves muscle engagement. There will be muscle engagement without movement. Okay, so patient in a lower body cast means cast. What is the purpose of the cast? To immobile that area, but at the same time we have to prevent the complications of immobility. So we need to give some sort of exercises. So we have to engage the muscle without movement. So such type of exercises are termed as the isometric exercises. Okay, so we will see the another options also, that is isotonic and isokinetic. Isotonic exercises, it rely on consistent resistance and a full range of motion to build the strength. Okay, so that is not possible for a patient in cast. Then isokinetic means here we are using specialized machines to help the body perform certain movements at faster speeds. So here also movement is there. Okay, so I think that differences, I think you understood. Okay, now we'll move on to the second last question in our series, and it is a GK, and the question is, light from the sun reaches us in nearly how many minutes? Okay, so the light from the sun will reach to us in how many minutes approximately? So the options for you are option number A, 2 minutes, option number B, 4 minutes, option number C, 8 minutes, and option number D, 16 minutes. So what is the speed of the light, and how much time it will take to reach to us from sun? So the answer is option number C, that is 8 minutes. Okay, 8 minutes is the answer. So we know that this is a basic science. The speed of the light is 3 lakh kilometer per second, and it takes about 8 minutes 20 seconds. Okay, approximately 8 minutes 20 seconds for the sunlight to reach earth. Okay, so this is a general knowledge information for you, and we will move on to the very last question in the series, and the question is, which is the antibiotic of choice for acute rheumatic fever? So the antibiotic of choice for acute rheumatic fever is, and the options are option number A, benzathine penicillin, option number B, amoxicillin, option number C, erythromycin, and option number D, vancomycin. So just think about rheumatic fever, how it happens, and you can find the answer for this question. So what is the answer? So here the answer for the question is option number A, that is benzathine penicillin. Okay, benzathine penicillin. So we know that acute rheumatic fever, it is an autoimmune disorder occurring in response to the infection with a group A streptococci. Group A streptococci. So we should target on this group A streptococci, and for that penicillin can be used to clear this group A streptococci infection, and it should be given as a single intramuscular dose of benzathine penicillin, also known as the benzyl penicillin, and the injection which forms the first of the 21 or 28 day dosing schedule, which is required for continuing the secondary prophylaxis. Okay, so benzathine penicillin IM is the drug of antibiotic of choice for acute rheumatic fever to compete the group A streptococci. Okay, so with this question we are coming to the end of the session, and the 20 questions what we have explained here definitely will be useful for you for your upcoming JIPMER exams and other competitive nursing exams. So we will be coming very shortly with another set of questions for prepare you well for the upcoming exams. So till that time, just signing out. So keep in touch, study well, all the best.